Hey everyone, Dr. Talley again here with sperocbd. So today we're going to be talking about CBD and pain management and the role that it can play with helping individuals who suffer from chronic pain. So we're going to be looking at a few questions today. Our first question is, what exactly are CBD capsules? So CBD capsules are basically a shell that contains the CBD oil on the inside of it. There are two main forms of capsules, and these are across the board, but in particular for CBD as well. There could be hard shell capsules and soft gel capsules. Usually people tolerate the soft gel capsules, a little bit easier to swallow, less painful for those that might have any issues with their esophagus or trouble swallowing harder pills. However, some people do prefer the harder capsules if that's their own preference. So there's not much of a major difference in terms of effectiveness, mainly just preference and what you prefer. Now, the big question here is, are CBD capsules good for pain? So currently CBD is used and promoted as helping with general wellness and optimizing everyone's health. So with that being said, there's a lot of significant interest in the medical community about CBD. It's a very promising substance right now. There's a bright future for CBD, it appears at this time. Now, anybody who says that CBD is a cure-all and can treat everything, it shouldn't be trusted typically, because with anything, not any given thing, not one thing is going to help everybody. So CBD, while it can help a large percentage of people, making them feel overall better, anybody marketing it towards treating something should not be done. Not only because there's not a research completed on these areas of interest yet, but also because it hasn't been evaluated by the FDA, and it's still considered a supplement at this time. So CBD should not be marketed as treating, preventing, or having the ability to cure any medical condition at this time. So the reason that CBD is so promising for the medical community is that, particularly chronic pain, is that it seems to have anti-inflammatory properties itself. So that's why it can be beneficial for those that are suffering from chronic pain issues, whether that's back pain, arthritis, anything like that. Even some inflammatory things that can come from autoimmune processes. There's a lot of research going on at this time. So the areas of big research currently, and there's more and more conditions that are being investigated for the utilization of CBD, but we're looking at things like autoimmune diseases such as rheumatoid arthritis. There's skin conditions. This is more for topical administration, such as psoriasis, allergic hives that can pop up. CBD may have a role with that. Alzheimer's and Parkinson's are areas of interest too, as well as PTSD and some psychiatric issues, and as well as depression. So these are some of the bigger areas that are currently being looked at. There's a long list of studies going on. If you're interested in seeing the areas that are being looked at, you can always go over to clinicaltrials.gov and just type in CBD in the keyword, and you'll see all the trials that are going on currently. And it's quite expansive. So I'd say so far, CBD does seem to be beneficial for a majority of people who take it, but our evidence currently is that it's anecdotal, meaning that the individuals taking it have reported these positive effects. And in terms of quality of data, that's one of the lowest forms of quality of data, because there's no controls, there's no large trials to compare things to. It's just self-reported ways that people are feeling. So there are animal studies and smaller clinical trials for human studies that have shown benefit, and there does seem to be a large area of promise for CBD, and there is a large amount of information that will be known in the next 3 years, most likely in the next 3 years, as some of these bigger human trials will be concluded, and we'll have much more information about the effectiveness as well as the guidance regarding CBD and which populations of individuals will benefit most from it. So stay tuned to see and hear from us more about that in the next couple of years here as we get more information regarding that. So now, why do individuals use CBD capsules? So I've talked before about different ways of administration. The capsules are just something easy to take. And especially in the United States, as well as some other countries, but in the United States particularly, we rely a lot on oral substances, medications, and things like that as our route of administration. So I think that capsules are just more familiar to those in countries that rely a lot on oral medications. So taking an oral supplement like CBD, the capsule just seems more familiar for those individuals. Now, the question also here that's important, are CBD capsules effective? And as I mentioned before, based on our anecdotal evidence and some of the smaller trials, the short answer appears to be yes. Now, the more important question is knowing which individuals is it going to be helpful for by having larger trials and looking at different medical conditions and seeing that it's safe and can be effective for those individuals to be taking. I would say for the most part, its safety profile is very safe. It seems to be that it's tolerated very well by individuals for the most part. And I talked about some of the issues and side effects and toxicities that can occur with other medications somebody might be taking. But for the most part, if you're a healthy individual or only on a few medications, always check with your physician or healthcare provider before starting CBD. But for the most part, people do tolerate CBD quite well, particularly when they start taking small amounts slowly and incrementally increasing until they get their effective dose. So, regarding the effectiveness, the other big component of that is bioavailability, which basically means the amount of the CBD that gets into your bloodstream that can actually be effective and get to the receptors where it needs to actually work. So when you're looking at bioavailability, some of the best products out there for getting the highest amount of CBD in the bloodstream, sublingual administration under the tongue, just placing some CBD oil under the tongue. It gets absorbed in about 30 seconds to a minute or so, and you'll start to notice the effects within a few minutes, maybe 10 to 15 minutes at the most for sublingual. Now the capsules, they have to be digested, go through the stomach, and get absorbed through the intestines, and some of it gets broken down by the liver. Sublingually, you don't have to worry about the liver breakdown. So your amount that gets into your bloodstream is a lot higher when you're talking about administration under the tongue, because more of the CBD will actually get to where it needs to go without basically by bypassing the liver. So there are other routes of administration that can be effective. Vaping, but there's always the stigma associated with vaping right now, and if it can injure the lungs or not, regardless of whether it's CBD or tobacco, it might just be the mechanism or delivery device itself for vaping that could cause lung injury. So while the bioavailability is high for that, there still should be some caution around that, as we don't have good information about the safety profile for vaping at this time. And if anything, there's data suggesting that vaping is probably harmful. Now, next question is, where can you buy CBD capsules? So whenever anybody asks me this, you should always look for a company that has transparency. And what that means to me is non-GMO, organically sourced hemp that they derive their CBD from, and also allowing individuals or consumers to have access to third-party quality data that they can actually look to see that their CBD product contains what it's supposed to and doesn't contain what it shouldn't, meaning no or low THC below the 0.3%, and then no heavy metals, solvents, pesticides, or microbials are present in that CBD product. If you're not able to find those things and check those boxes off, maybe steer clear of that CBD provider, because if the market is full of CBD providers at this time, and you want to ensure that you're getting what you're actually paying for, as well as you're not putting something harmful into your body. So those are the things that I would typically recommend. And so that's why I do recommend sperocbd, because not only do we check all of those boxes, but we also donate 3% of CBD products back to the community as a way of giving back for those who are in need of CBD products but maybe can't afford those. So if you have any more questions, feel free to reach out to us. Also, feel free to visit sperocbd.com for premium products, as well as a ton of educational content. I want to give a quick wave to everybody who's waving to me right now, and thanks for joining us today. So stay tuned. We'll be back in about 2 weeks or so, and stay healthy. Thanks.